Hey, how is it going, everybody? Dr. Scott here. We are going to be talking about flexibility, nerves versus muscle versus nervous system with dance physio Erica. So, can't wait to get in here. She is here. I will get her in. Let's see how this works.
Hello.
All right.
All right. Looks like we're all ready to go.
We are ready. So typically, if you don't mind to start, to give some people some time to join, would you mind giving a introduction to kind of you and your interaction with dance?
Yeah, absolutely. So my name is Erica. I'm based in Vancouver, up in Canada. And I grew up a dancer. So I danced right from when I was like 2 or 3 or like really little. And danced up and sort of did a little bit of dance in college, like sort of a minor, but did a kinesiology degree when I was in university, and then went on and did physio and have been working with dancers ever since I graduated. I did one of my practicums for physio school down in Australia, and did Dance Medicine Australia. And so that was sort of like my main kind of training or official training. I've been involved in the dance community and involved with IADMs, and I'm on the board of Healthy Dancer Canada as well, so I'm quite involved with them. And so that's sort of my background. I work, I would say, primarily with adolescent dancers. That's kind of like my main focus. That's what I spend most of my time with. I work with some professional dancers and touring companies coming through town as well, but most adolescent sort of pre-professional level dancers. And then I also do a lot of work with teachers, like teacher workshops and teacher training, like that.
Awesome. And recently, was this your first presentation at ADMS or?
Well, I've presented quite a few times before. I think the first time I presented was in Birmingham, I believe. So like
nice.
2010.
Yeah, a while ago for sure.
Yeah, my first Adams was 2007 in Australia.
Awesome. And for those who don't know, that's International Association of Dance Medicine and Science. Dance Medicines. Yeah. Okay. Awesome. So did you know in university you wanted to specialize in dance because you had some dance history?
Yeah, that was kind of my goal.
Okay. Well, just to do a quick introduction for anyone who's new and doesn't know me, my name's Scott. I'm a doctor of physical therapy and personal trainer, strength coach. I came from the complete non-dance realm. I came from a sports realm, was involved in strength and conditioning in university athletes, then PT school, then mainly adolescent athletes trying to go collegiate. And then I started dating 5 years ago a dancer who was in a lot of pain and slowly started working through those things and kind of developed a passion, thought there was a lot of room for improvement. So now that's all I do is work with dancers. So awesome. Okay. And so our topic today, what we're going to be covering is kind of flexibility in general and comparing, are you stretching muscle, nerve, nervous system, and kind of digging into that a little bit, right?
Yeah. Sounds great.
Okay. So how about we just start off with, if you can give us a little introduction into how might someone know what they are stretching or what they should be stretching, whether nerve.
Yeah, great place to start. So I think before we even get into whether you know what you're stretching, it's important for people to realize that the nervous system plays a massive role in flexibility training. So when we think about flexibility or we think about stretching, I think we always think that we're stretching our muscles. And in sort of traditional or historic kind of stretching routines, that's generally what we think about stretching or trying to stretch. But our whole musculoskeletal system is basically controlled by our nervous system. And so a lot of the times our nervous system can actually impact our mobility more so than the muscles, or potentially can impact them more so than the muscles. So I work with a lot of dancers who, again, because my population tends to be adolescent, a lot of growth spurts, a lot of like increases in training hours, things like that, where I'll get people coming in complaining about like sudden decreases in flexibility, or they've like been working on trying to get their splits for years and years, doing the same stretches they practice every single day, and they're not getting any more flexible. And so when we have those types of situations, sort of need to take a step back and look at it and think, okay, well, maybe this isn't actually just sort of a muscle stretching issue, and maybe we need to actually sort of think about the impact of the nervous system and how that might be affecting flexibility or mobility. So yeah, we have nervous system and then we have muscle tissues, and sometimes it's tricky. I mean, it would be really awesome if there was like a little gadget we could use that would just tell us that like, oh, this is muscle, this is nervous system or something, but obviously there's not. So there's some things that we can sort of use clinically. I think one of the things that to me is like a big sort of like red flag or something that sort of will often be like, yes, this is probably more nervous system or maybe this is more muscle, is if it's changing really rapidly, like either they've had a really big decrease in flexibility, like suddenly, or like within one session of me doing a few things with them, all of a sudden their flexibility's increased massively, then chances are it's not the muscle. Chances are we're then looking at nervous system influences, because muscles, we can stretch them, and there's different theories about how that happens and whether, we're not even going to get into that today.
Yeah,
there's theories about that, but it takes time. It's not going to happen instantly within a few minutes or within one session. It takes sort of time, and we expect to see results over a much longer duration. So for me, that's one of the big things, is if you're seeing things change like quite quickly, it's probably more nervous system sort of generated. The other thing too is like big fluctuations up and down. Like one day people will feel sort of really flexible and the next day they're having a tight day or things like that. Again, you're not going to gain or lose muscle flexibility that rapidly. Like if you're having changes from day to day, it's much, much more likely that's related to nervous system, and that can be from influences like lack of sleep, or you're dehydrated, or you're extra fatigued from extra rehearsals, things like that. So
I think that's actually a really good point. I think I want to highlight, because I see a lot of the dancers I work with come, maybe they say like after maybe a very busy rehearsal, they're like, I'm so tight. And I think, so what I'm hearing from you and what I usually tell them without seeing them, I'm like, well, already if you were fully flexible in the morning and you feel really tight afterward, probably not, your muscles don't need to be stretched, but they're sore. And you're saying, and that could be a combination of a heavy rehearsal or poor sleep and other recovery methods. And then I think we'll touch there, but so then you might not be moving as readily. But what you're hinting at now, and we're going to go into, is that your muscles didn't shorten up and they don't need to be stretched back out at this point, right?
Yeah, generally. Like that situation you're explaining where the person comes in and is like, oh, like I felt fine earlier, but now I'm really, really tight. Well, you're probably, again, looking at something that's more going to influence like the nervous system input into the muscles, like in terms of recovery or rest or just other sort of techniques, rather than just going and stretching this muscle that probably at that point doesn't need to be stretched, because like you said, it's probably not actually truly tight.
So that's a good, just to highlight that, because that's a big point. I think and we'll keep moving here, but you mentioned if it's changing often, which I think is very important. So if it changes after a dance class or after a rehearsal, or maybe you had a really relaxed weekend, didn't do much, and you come back and you feel really tight, that is what we're talking about in these fluctuations. It changed from Friday to Monday. Yeah. You probably did not lose all your flexibility, but as we're going to get into, it's actually your nervous system playing into it a little bit, right?
Yeah, exactly. And that tends to be more like the central nervous system, so sort of like the control center of the nervous system, because it's really sensitive to, things like fatigue and rest and recovery and even stress states. Like if you're anxious about an audition or like just stressed out about anything, really, your central nervous system is going to respond to those sorts of things. So there's that aspect of the nervous system. And then we also have sort of the more mechanical aspect of the nervous system. And so that's sort of a little bit what I think we're going to talk a bit more about today, is that mechanical aspect. So we can actually have decreases in the mobility of the actual nerves in our body as well. And so this becomes a little bit more complicated sometimes to tell if it is truly like a muscle length issue or if it's a nerve mobility issue. So just super, super quick, muscles are elastic in property. So I always use this example that like muscles are kind of like an elastic band. Like if you stretch the rubber band, when you let go of it, it's going to relax back to sort of its original resting length. And if you keep doing that over and over and over again, eventually it's going to start to stretch out a little bit and it's going to relax back, but not to that same resting length. It's going to relax back to a little bit longer. And that's sort of how we think of stretching our muscle tissue. Nerves don't stretch the same way muscles do. They're not elastic like muscles are. And so if you think of a nerve a bit more like a string, so it doesn't have that elastic property, and you can pull it, but if you pull it, you're just creating more tension in it. It's not actually stretching in length. So when we're thinking about issues in the nerves, and we're talking about, again, now mechanical issues in the nerves, it tends to be more a mobility issue. So not a sort of stretch issue, but more, we call it like sliding or gliding. So we think about the nerve moving from like one end of the system to the other. So whether that's the length of a limb or through your entire nervous system in your body. So nerves tend to be structures that like we can pull one end of that string, but the other end's going to then come closer to it, or we can pull it the other direction, but we're not really an elastic stretch in it. So that's one concept that's really important to understand, to then be able to understand if we think or if we think that we're dealing with a muscle that's tight versus a nerve that might be sort of restricted in that sense. Okay, so to make sure everyone's keeping up, and I love the examples. I think that's pretty clear and everyone should get that. But we've actually explained 3 different things that might be affecting your flexibility. I'm using that term, I guess, globally, very, very loosely. Maybe, like you said, your muscles have never achieved a certain motion yet. And I think in adolescence, in the younger dancers, we might see some of this. So you've never been able to get your split. Well, you've never achieved it. It's being pretty steady and it's steadily growing or improving. We have one we're leaning towards muscle there. Without digging in, there are some other factors, or we have some that if they're changing a lot, or it got really good and it got really bad over the course of a week or so, we're probably going with central nervous system. That's like your body's control mechanism. And now you're going to get into, what if your nerve is actually, the actual physical nerve is limiting some of your motion, right? Yeah. Before we discuss how to distinguish muscle versus nerve, could you, and I know this is kind of a deep topic, but you have anything you could share about what might have caused someone's nerve to be tight or limit them? Yeah, for sure. So one sort of instance that we see really commonly is like post-injury. And so what we'll see is if there's sort of scar tissue that develops or abnormal movement patterns that develop and things like that, that can really affect like sort of nerve mobility into there. So that's probably one of the most common sort of things that we see is people who've had an injury, and it doesn't have to be an injury to the nerve at all, but just an injury somewhere that surrounds that. If you've had swelling or bruising or anything that can kind of impact that mobility of the nerve in through there. So that's probably the most common that we see and what we're dealing with most often. But certainly we see it a lot in, again, adolescent growth spurt sort of population. So no injury, but not everything in our body grows at the same time. Muscles don't grow at exactly the same rate as bones and nerves. And so you get sort of these like changes that are happening in the body, and there's such a rapid acceleration in growth during that adolescent growth spurt that it's not uncommon that we'll see that all of a sudden their bones have grown way longer, but the nerves haven't quite caught up, or they haven't sort of lengthened or stretched out or done their growth basically. And so we see that, and I would say that in, again, the population that I treat is probably the most like common in a non-injury situation.
And when you say injury, we don't mean major injury. We could mean like an ankle sprain, like you said, any kind of thing that maybe causes swelling, or if you maybe had to splint or something, like if you wore a tight knee brace and that limited your knee motion for a couple weeks, anything like that. Yeah. Right? Cool.
Yeah, absolutely. And then the other things that, I mean, less commonly, but people who do a lot of repetitive sustained positions, you can sometimes develop limitations just based on certain, we'll see it with people who have really like static posture type work or that sort of thing, or certain choreographic demands in dance. Like if there's like a, strange choreographic thing that you're going to especially see in like contemporary type dancers where maybe they're doing some like roll on the floor that maybe is just kind of irritating things, and there's no traumatic injury, but it's just over and over and over again, that repetitive, that could potentially limit things as well. But I would say the post-injury and post-growth spurt are by far the most common ones that we see.
All right, great. Okay, and then I think now, so how do we distinguish them? Now let's get into that. Let's give someone some ways to look.
this becomes a little bit more clinical and isn't always something that you can sort out yourself without potentially needing to see like a physical therapist or somebody who can maybe do a more in-depth assessment. But there's a few little things that we can do that might lead you to think, okay, maybe this is more nerve versus more muscle. And maybe if you think it is more nerve, you might want to then go get a more in-depth assessment. But I think the key is understanding a little bit of basic anatomy. So the easiest example, or the one that people are probably going to be most familiar with, is if we think about our hamstring. And dancers always want more flexible hamstrings. Everybody wants a more flexible hamstring.
Yeah.
So our sciatic nerve, so hamstring runs down the back of the leg, and the sciatic nerve basically runs down the back of your leg as well. But the sciatic nerve starts in your low back and then comes down the back of the nerve sort of along the length of the hamstring, but it actually goes all the way down your leg and into your foot and into your toes. Whereas the hamstring muscle itself only goes from the back of the hip essentially down to the back of the knee. So the hamstring muscle itself is shorter, sciatic nerve runs all the way down. So there's a few little tests that we can do to see if maybe what people are feeling is sort of truly muscle tightness versus potentially like a nerve limitation. So the easiest sort of example of that is if somebody goes into just their like standard hamstring, you're lying on your back and you like lift your leg up, pull it towards yourself in your like hamstring stretch. When people get to that limit of motion where they start to feel a stretch or tightness, if you then ask them to like flex their foot, like pull their toes towards their head, we'll then sort of like kind of ask them to see if there's any change in that sensation they're feeling. And so some people will say, nope, feels exactly the same. I still just feel it in my hamstring in through there. Other people are going to pull their toes towards their head and they're going to feel like a really big increase in the amount of tension that they feel, or they're going to feel it somewhere else. And the most common one we see is they'll feel it in the calf. People will say, oh yeah, I feel a big stretch there, but I feel it in my calf, which that's not a stretch position that we think of for sort of stretching calves. We think we're in a hamstring stretch position. We haven't changed the length of the hamstring at all by flexing our foot up, but we have changed the amount of tension on that sciatic nerve. So that's just kind of little things that we use, just knowing the anatomy of like the muscles versus where the nerves travel, where we can add tension from one end of the system or the other end of the system to see if we think, okay, did that change the sensation they're feeling? If it did, and we didn't change the muscle length at all, then we know that it's probably not the muscle that's influencing things. It's probably the nerve that's influencing things.
Awesome. And that was, and I think it's such a clear example. I was in my head thinking, just one of our other tests, slump test. I'm like, that laying on the back is actually an easier one for everyone to visualize. So I think that's
exactly, because dancers are familiar with that stretch. Like the slump is definitely more clinical and it's useful in that setting. But that sort of lying on your back, and it's one that teachers can do as well. Because again, I work a lot with teachers, and so it's one that I'll often sort of teach to a group of teachers so they can sort of see in their students. Because again, they're always complaining about, oh, my students have tight hamstrings, and well, really, a lot of them don't actually have tight hamstrings. So there might be something else that's limiting them in through there.
So for any instructors or dancers who watch this, so we lay on your back, you lift your leg up in the typical hamstring stretch. When you start to feel your resistance, and flex your toes down towards the ground, back towards your head. And if that increases it, especially in your calves or somewhere else, it's probably related to nerve because the hamstring doesn't go to the foot. So if I move my foot, I shouldn't be affecting the hamstring.
Yeah,
and I think...
I was just going to say, even if you feel just like a huge increase in the amount of tension in the hamstring itself, again, we haven't moved the hamstring, so it's still probably nerve in that case.
And I think that can be applied. I think if you're suspecting one or the other, it's probably worth getting help from someone who can really dig in. But just another way to simply do little tests to figure out is also with the head, right? If we bend our head and it changes, we know my hamstring doesn't touch my neck. But if that changes it, probably less in the foot, but we're dealing with the nervous system.
Absolutely, yeah.
Awesome.
It's sort of continuous, right, from like the brain and the coverings of the spinal cord, like all the way down to the toes.
Yeah.
So, yeah.
Okay. And then how about we discussed now nerve versus muscle, but what about, I guess we kind of covered if it might be nervous system due to fluctuations. But I wanted to dig in as maybe a final topic on that one. If someone is noticing fluctuations in their flexibility, so we've now said it's probably not your muscle because it's changing too quickly, muscle doesn't adapt. Probably not your nerve because nerve doesn't adapt very fast either. It's actually your nervous system. So it's a control of your body, control of your motion. Do you think we can cover just briefly maybe what that means for a dancer, what they might need to be working on instead?
Yeah, for sure. So, I mean, it's a little bit of a complex topic in the sense that there's so many things that can influence the nervous system. But in terms of like its relation to flexibility or mobility or that sort of thing, I think for dancers to be aware of sort of what state their body is in at any given time. And so we touched a little bit on whether, dehydration or lack of sleep or fatigue from rehearsals or performances or whatever, but also like mental state for sure. So stress, anxiety, things like that. So I have a lot of dancers where a lot of what I'm doing for their mobility training is actually doing a lot of like, deep breathing or visualization or meditation or things like that. And you can actually we joke that we are training the parasympathetic nervous system, but really like you're just trying to down train that. It's that fight or flight response, if people have heard of that before. And that fight or flight response is going to cause your body to tighten up so that you can run away from whatever's going to eat you or whatever. But instead of like a dance situation, we need to down train that by using, breathing, meditation, whatever it is that works for that dancer to be able to regulate the nervous system a bit better so they can access their full facilities. So that can be really effective in especially the short term, or if it's something where they know like, they start to see patterns where they're like, oh, every time I have a bad sleep, the next day I feel a lot tighter. And so they can start to recognize those as opposed to just thinking, oh, I just need to do more stretching because I'm getting tighter or I'm getting less flexible. Yeah. The other, and this is more of a little bit of like a long-term or sort of more chronic-y, but our nervous system always needs to feel safe. Our nervous system doesn't ever want to feel threatened. And it's, like I said, it's kind of the control center of your body. It's like king or queen or whatever. So everything has to go through the nervous system. So if the nervous system feels at all threatened by anything, it's going to limit mobility to protect you so that you're not going to hurt yourself. So we see this a lot, that people think they're really tight because they can't get their leg up, in développé or whatever it is. But really it comes down to actually being more of like a control or a strength issue. So, if I passively lift their leg, I can get their leg up, or if they like kick it with more momentum or things like that, they can get it up, but they can't actually sort of physically get it up themselves. And that often comes down to sort of a strength issue or a control issue, not always strength, sort of motor control. And the nervous system's always going to kind of like err on the side of protection and not allow you that mobility if it doesn't think you can control that mobility. And so again, sometimes what we're working on for people who are trying to gain flexibility is actually just working on what I call like end range control. So taking them to the limit of where they can currently control something and then working on strengthening it in that position so that their nervous system feels safe in that position. Their nervous system knows that they're not going to injure themselves in that position. And then it's going to allow them to go further and further and further into it. One of my sort of examples I always use with patients with this is when people are under anesthetic, like if you're having surgery or something like that, like you're unbelievably flexible. I remember being in a total hip replacement surgery and the guy was like 89 years old and the surgeon was like, want to see something cool? And they like put him under and then he was just like, look at him. And the guy could like basically do the splits, which he could not do in regular life. But again, it was his nervous system that was just really, really protecting, and he still had loads of flexibility in his muscles and joint mobility and all of that. So our nervous system has a massive, massive impact on how much like mobility our body will like allow us to have, basically. And so control and strength can play into that hugely.
Yeah, and I think I don't want to go too deep because this is an area I'm super passionate about, more in the control side when that's what we're dealing with. But there's been some really interesting research coming out. And I think just one example, and it's not something I think everyone needs to go do, but in the micro stretching, have you seen where they're stretching at like 30% of their maximum? So if anyone thinks of that hamstring stretch we showed you and you pull your leg up and it's coming up here, 30% of that would be like, less than halfway. So you probably wouldn't feel a stretch. But I think it goes back to some of what she said about parasympathetic, which is basically just a relaxation, that holding that produced better results in their study than end range stretching, so pulling it all the way. So meaning stretching 30% of your maximum, where you probably don't feel much of a stretch at all, only over time actually produce better results, which is interesting. I don't think I'm trying to sell that method at the moment, but I'm just saying I think this is an interesting some of these other areas that we're coming into with stretching and flexibility.
Yeah, exactly. There's so much more to it in terms of like, you know, what we used to be sort of the more traditional, just like passive static stretching, which dancers are really, really good at doing, is not necessarily the most effective way of gaining flexibility if we're ignoring all the other aspects of things that contribute to it.
And I think, like you said too, I think in most times, or you might not have said this, but I think I'll go there and you correct me if you think I'm going too far. Most times it's not your muscles limiting, especially in the dance population, I think. That because as we see when we put people under for a surgery, they move all over. So it wasn't their muscles that were restricting them, because muscles don't just get longer magically. But it was them, they feel uncomfortable when they try to do a split as a 90-year-old. But if we take their body and it's fully relaxed and has no control, oh, look, I can do it. So would you agree with that statement that most of the time, not always, but most of the time it might not be?
Yeah, absolutely.
Yeah.
Certainly more common than what I think has historically been like represented in not just the dance world, but other athletic populations and stuff as well. And so there's definitely a lot more sort of like, like schools of thought coming out and like that are addressing those types of like kind of approaches to mobility or to flexibility or to that stuff.
Yeah. If we go to one example, I had a question and I'm forgetting her name. I think JD Line 5, I hope that's who it was, but asked a question on our post earlier. If anyone else has any questions, please feel free. That would be a good example of this. She said, what about some dancers who always have a tiny bend in their knee, no matter how much we stretch it? I think this might highlight what we kind of just talked about. Could you explain what you think might be going on there?
Yeah, absolutely. I mean, there are a very small percentage of dancers who like physically, anatomically don't actually have full knee extension. So assuming we're not dealing with those, because the majority of your dancers are not going to have that, that would be a really small percentage of dancers.
And I would say the good thing before that is you can test like on the ground with their legs on the ground, can they get straight? Yeah.
Exactly. And I get this question a lot on teacher workshops. They say, you know, kids sits legs out in front, they can straighten their knee, or I can straighten their knee, it gets fully straight, but as soon as they go to lift their leg, and it's not always in a position of like hamstring stretch, if you will. So if it was only in that position where their knee was always tending to bend, so say their legs coming to the front, like développé devant, front kick, whatever, then potentially there could be some hamstring limitation going on. But more often than not, it's actually like in arabesque, it's in second, it's in all sorts of positions. It's any time, or even they're doing like releves or things like that, and they're getting that little like micro bend or that tiny bend. So generally that comes down to them not having that end range control of that sort of, in this case, of the knee bend. It would be like quad control to be able to get into that end range and be able to control that. And so again, it could be that sort of nervous system protection mechanism where it's just keeping that sort of bent in through there as like a protective thing. So really working on strengthening rather than stretching is going to be way more influential.
Yeah, that's awesome. I think that's exactly what I was going to, is in that position, and that one, the quad. And I think we touched on, but just to give another example, is you could also, if you notice they're doing it in arabesque or in, you know, any extension to the front or side, if you assist them, if you can hold their foot and it gets straight, we can be 100% sure it's not the hamstring, because it goes there. So now it's a control. And I think that's a great way. And I think you mentioned this already, but it would apply here as well, that so then we can try to strengthen that area. So maybe if we're doing whatever movement it is, if we go a little slower, or we focus on the knee straight, and they're straight at the beginning, but as they hold it longer, it bends, or as it gets too high, it bends. Adjust that range. And that's one way I would do it. I don't know if you have another quick example of how you might, I mean, there's a lot of specific exercises we could do.
Yeah, I was going to say, there's
ground,
lots of specific things you could do for them to be able to like feel the activation and get that sort of thing. I think in a lot of those cases too, and again, especially if you're working with younger kids, it often can actually come down to core control as well. So we think quad, in that case, like it could potentially be quad, But there can be a lot of like inhibition that happens in quads or hip flexors if there's weakness in the core as well. And so depending on like how this dancer's presenting, that actually might be what I go after first, is working on the sort of central stability, because if they have that, then maybe their nervous system then says, okay, now that we're stable here, we're safe in this position, now you can do whatever you want with your legs. I don't care, because that's something that we see really commonly. So yeah, I think it would depend for me on whether it seemed like it was coming more from a core perspective versus, okay, this is really just an isolated quad sort of thing going on.
But then that goes back to your mention of safety. So if I'm unstable, moving around, and I guess going as far as the core, even the stance leg balance or other things, or recent injury around the knee, it's almost a protective thing. And in that case, it's addressing what the other issues are before we start working that knee. So if you notice their position's pretty off, or they're pretty unstable or shaky, maybe before you worry about the knee, help them feel more comfortable and stable in those positions from the rest of the whole body.
Yeah.
Awesome. I think that's great. This is the first, we haven't had any questions in the chat that I've seen. So I'll give guys, if anyone has anything they want to mention in the last minute about stretching, flexibility, nervous system, nerve, muscle, feel free. While we let them do that, do you have any wrap-up comments or anything you think we didn't touch on that you'd like to?
I mean, I guess, and this is kind of opening a whole other can of worms, but I mean, there's been that massive trend towards all this like overstretching, extreme flexibility.
We should touch on that.
And from sort of just like a safety perspective, there's obviously lots of risks involved. And I'm by no means saying that people can't safely achieve high levels of flexibility, because we see it in other sort of avenues, even within some dancers. But for me, for it to be something that is done safely, it's all about control, and it's all about end range strength. And until you have that, working on all sorts of like overstretching, oversplits, things like that really is not going to be at all effective. And if anything, is just going to put dancers at risk for injury.
Yeah.
So there's nothing I hate more than like seeing a like snapshot of a whole class, and the like caption is like, oh, working hard at their stretching, and they all have their feet up on like 4 yoga blocks, but none of them are anywhere close to the floor. And so they're just hanging in midair. And like, there's so many more effective ways that we can gain mobility. And so, yeah, I guess that's my only other sort of like wrap up that's not directly related, but I feel like it's sort of worth stating.
I think that is worth saying. I think that'd be a fun, actually, whole nother topic. We could come back and just talk overstretching. That's really one of my like passions. Because I don't want to, but things we didn't talk about, which are maybe at risk. We didn't talk about ligaments. We didn't talk about tendons. We didn't talk about actual joint congruency. And all these things overstretching might affect. So there are risks. My typical, just to give my opinion on that, is they should first have full control of their range before we need to add more range. And I think the easiest way, and it's specific in every position, but the easiest way I demo this is like an extension, a controlled extension, not like a quick développé, but or just a slow controlled développé. How high can I get to the front? And then how high, if I held my leg and did like a heel stretch, how high does that get? Or even just do the heel stretch, let go of the heel stretch, how far does it drop? If it drops more than like a few degrees, we don't have control of your current range. There's no reason to stretch it higher, because we don't have control there yet. So I think that's a great caveat that we're both going to say, and I agree with you, and I think some go hard no. I think there could be some people who might benefit from overstretching, but like you said,
deal with like a fair, I don't know if it's as big down there as it is here, but like right now, like tons and tons of acro and circus, and like it's really, really popular. And so that's starting to be a bigger part of my like clientele. And like, I mean, there's certainly deficits in that world as well, but I do think some of the like kind of acro circus people do a much better job of strengthening, especially because some of the stuff they're doing, you can't do it without having the strength. So we see higher levels of sort of extreme flexibility or even contortion like stuff, but that's really, really well controlled, which I don't think the dance world does nearly as well. And I think it has to do with training from like young ages that we just, that's not a focus right now, but definitely something that, But
if we have more people like you coming out and giving all this awesome information, hopefully we and education to the dance schools, hopefully we can kind of change how they're going about this.
Absolutely. And so that's one of my, one of the reasons I like working with teachers a lot, because you're going to influence the most number of dancers if you can get to the teachers. And then there's some great organizations that are sort of trying to do some of that work as well, like some of the acro organizations and stuff like that. So it's definitely, I think we're headed in the right direction, but right now we're kind of in this awkward phase where there's like a huge amount of scary stuff going on. Yeah,
I agree. And I think, like I say, sometimes things have to get worse before they get better, but I think we are on the track.
Kind of like, I hope as far as it's going to go, and now
we're coming back.
Hopefully.
Awesome.
Yeah.
Well, Erica, thank you so much. I think that was hopefully very informative for everyone else. I enjoyed hearing all that stuff. And I guess we already did final comments. So this will be posted Friday, and I guess that's it.
Yeah, awesome. Thanks.
All right. Thanks.
Yeah.
You have a great rest of your night.
Yeah, you too.
Bye.
Bye.